So this is a letter shared from one of our HealthWorks business partners, Messick's, who was sent to us by their leadership team on behalf of a colleague they recently lost. Dear Penn Medicine HealthWorks, Tuesday, March 12th, 2024 started as any other normal workday, but around 2:55 p.m. things changed. One of our own members was standing near his desk in the showroom talking to another salesman when he slumped over, fell to his back, and began gasping for air. One of our managers immediately ran across the showroom to the Penn Medicine HealthWorks clinic as another called 911. 3 healthcare providers, Christy Galbraith, Louise Moore, and Deborah Steinmetz, immediately ran across the showroom and started CPR. They worked together seamlessly as another Messick's employee retrieved and administered the AED. They continued administering life-saving techniques until emergency services arrived. These women were heroic in their efforts, and we want to thank them from the bottom of our hearts. Sadly, our colleague passed away on March 24th at the age of 56, but we know that any chance he had was given to him that moment a week prior by the HealthWorks team. Due to the care provided and our colleague's choice to donate his organs, he was able to save the lives of others. This has been extremely difficult for our Messick's family, which includes our Penn Medicine HealthWorks on-site clinic. But we are so very grateful for their acts of service in our time of need. Sincerely, Jay Gaynor, General Manager, and the Messick's family. This to me just reinforces how truly impactful the work we do is. As a nurse and the manager of Penn Medicine HealthWorks, I'd like to share this story through the perspective of the team. On March 12th, 2024, one of our providers at Mount Joy, Christy Galbraith, called my cell phone out of breath and distraught. By the tone of her voice, I could sense the severity of the issue at that time, and she was asking me to call the patients that she had scheduled that afternoon and reschedule them for her. I knew that they had the situation under control, so I began calling patients for her. From there, the response came fairly naturally. I think we realized that the next couple of weeks were going to be really tough ones. We learned later that day this Messick employee was taken to the ICU, and we knew the severity of his condition. What was unique about this situation, I think, was that we also knew the relationship that our provider and clinical team members have developed with the Messick's team and the Messick's employees. We knew that they were going to be right there alongside the Messick's staff for this journey, despite the ending. We went to Messick's Saturday with our team, heard what they were going through, and to be honest, we cried with them, myself and Dr. Beidler, the managing physician. As healthcare professionals, we know that we may experience an emergency situation and that it's our duty to respond. However, no one anticipates walking into work at a primary care practice, seeing someone outside of their practice go into cardiac arrest, run a code, administer CPR, and shocks in the middle of a showroom surrounded by colleagues, friends, and community members. All of this was done while they were on display. Our LG HealthWorks team experienced the same level of shock that Messick's did that day. The support for our own team didn't stop once this employee was taken to the hospital. I reached out to my leadership team, who was extremely responsive and got me tied up with the director of chaplaincy services. We connected with a chaplain named Gabby. She came out to Messick's twice and met with the team and had a debrief with them. I reached out to Holistics, and we had a wonderful therapist named Michelle come out and offer chair massage to our team members. I also reached out to the wellness team, and we had a coach, Gail, who has been following up with our team members throughout this journey. Importantly, the resources we offered to each other, we were able to extend to the Messick's team members that were struggling as well with this event. I have difficulty putting into words how much the support of our system and our leadership was valued by this team and by me. I've reminded our HealthWorks Mount Joy team more than once that while the outcome was not what they had hoped for, what they gave this patient and his family was hope and time. They gave them time to spend with him, to talk to him, to grieve, and to say goodbye. I'm beyond proud to work with Christy, Louise, and Deb, and I'm honored to work for a system that provided us so many resources for our team as well as the Messick's team. Our jobs are hard and the outcome isn't always favorable, but what we do makes a difference. We do provide security and stability in the most fragile moments for people, and that says a lot. In the good moments and in the tough moments, what we do makes a difference. Wishing my HealthWorks team and all of my colleagues at Penn Medicine Lancaster General Health a happy Hospital Healthcare Week and a sincere thank you from the bottom of my heart for what you do every day.